This video is part 4 in our soft tissue-based shoulders injury series. In this video, we will be covering the function, palpation, and treatment of the subscapularis muscle. What's up, everybody? For those of you that don't know me, my name is Dr. Matt Maggio. I am the creator of the 𝐓𝐡𝐞 method and the founder of the soft tissue revolution, where we teach manual therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. This is the last video in our 4-part series on soft tissue-based shoulder injuries. In part 1, we covered clinical presentations, functional testing. In part 2, we covered the posterior capsule functioning, palpation and treatment. In part 3, we covered the infraspinatus functioning, palpation and treatment. Links to all those videos will be included in the descriptions below. So where does the subscap live? It is on the front part, the anterior part of the shoulder blade. Sits right down in this area. The function of the subscap, it's classically considered what's called an internal rotator of the shoulder, but it also provides a ton of anterior stability for the shoulder. And a lot of people end up having a lot of issues in this area, specifically because right on top of the subscapularis, the neurovascular bundle starts to form there. You have all different branches of the median nerve, the ulnar nerve, radial nerve, musculocutaneous nerve, all sorts of nerves. And what happens over time is with bad shoulder mechanics, bad functioning, those nerves can actually get adhered to the muscle and they can create what's called a nerve entrapment. Nerve entrapment presents with numbness, aching, burning. Tension can be a really big deal. And a lot of times this subscap gets really beat up because it's the only muscle that really supports the shoulder from the anterior. So clients and patients that I end up seeing a lot of issues with the subscap is definitely going to be like my overhead athletes, people that are very active, doing a lot of overhead work. I also see this a lot in people that have had histories of a lot of shoulder trauma, possibly separations, dislocations, just played a very violent sport, just overused, repetitive kind of stuff. Those are the type of people that I end up seeing having a big problem in that muscle. So the first video I want to include this week is actually a very detailed palpation of actually finding the subscapularis. What I end up finding is so many practitioners actually aren't even on it. They end up being on the teres or the lat. They're too compressive, hurts like hell. In this next video, I'm going to show you how to slow down, use landmarks so you can make sure that you're on it exactly, because I always say if you can't find it, you can't fix it. So I'm going to link that video up right now.
Now the last muscle we're going to look at is going to be the subscap. So I'm going to lay on your back. And for this one, be nice and use a little bit of lotion, unless you don't like the patient. So essentially, the way I like to set this up is I like to open this up and I let the table do the work for me. So I let this relax right here on my quad. This allows everything to relax. I get the lotion in there nice and easy. And then essentially, what I want to do is I want to find some landmarks to let me know I'm on it. Usually what happens when people treat this subscap, they're actually putting pressure on the teres major or the lat, and it's not an effective treatment. A lot of people are like, oh my gosh, that hurts so much when they get it treated. It's because you're not on the subscap. So essentially what I like to do here is open this up, and then I pinch here, and I know this is all the lat, and this is all the teres, and then I know up here is the pec. And what I want to do is dissect the middle of that, and I'm going to go in. And I want to aim right up towards the throat. And what I'm able to do is once I find those landmarks is I sink in nice and slow. And if you go in too quick, you're pulling skin, the patient will not like that. So I sink in nice and slow, and don't rush this one. As you sink in, your thumb should start to disappear. If you're seeing the whites of your thumb or the nail, you're actually on that teres or that lat. So what I do is I sink in nice and slow, taking my angle right up towards there, and then I go all the way in until I feel the skin push back on me. Now I know I'm as deep as I need to go, and I back out just a little bit. And then the key here is you're going to take your depth straight down into the tissue, and it's not that thick. A lot of people are way too compressive, and it doesn't need a lot of compression, so you just let it sink straight down and get in there and feel what you can feel for palpation, see if there's any scar tissue in through there and if it needs treatment. Now, the thing about the subscap is it's very important. It's the only muscle that stabilizes that shoulder from the front. But the problem is a lot of people are too quick with their palpation. They don't find their landmarks. They don't get in there how they should. So be slow with it. Find your landmarks, and the subscap palpation will be a lot easier and less excruciating for the patient. If people are wincing in pain, it's either because you're on the lat, you're on the teres major, or you're pulling too much skin. Slow down, use some lotion, and make it a more effective palpation so you can get information about what's going on in the muscle so you can treat it effectively.
Couple take homes from the palpation video. Number one, I keep saying this, go slow. Next is just use landmarks and guidelines to make sure you're going to be in the right area every single time. And then also understand that this muscle is very thin. It's just on the front part of the shoulder blade itself into the scapula. I talked about this a lot in the 𝐓𝐴 training video. It's very thin. There isn't a lot in between there. It's the same thing for the subscapularis. And what I end up finding is that people put way too much pressure, way too much depth, and it's very uncomfortable when they go on there palpate that. So understand the mechanics of it, where it goes, and finding all those landmarks will make sure you're on it every single time. In the next video, what I want to share is an actual treatment demonstration of what I call manual scar tissue treatment to the subscap itself. It's from one of our training courses. I'm going to link that video up right now.
Now, once we've cleaned up the capsule and we've cleaned up the 𝐵 spinatus, now we need to get in there and clean up the subscap. And you got to make sure you watch the video over and over again about the palpation of this subscap and being very precise, because if you're off just a little bit, you're going to be on the nerve, you're going to be on the lat, it's going to hurt like hell for the client, and you're not going to get an effective treatment. So the way we want to look at this is essentially if the shoulder is sitting like that and you're going to come in through that, the subscap sits on the top of that. And what happens is a lot of people, it's very similar to the 𝐵 spinatus where there's not a lot of tissue in there. So you want to get it just right. And I like to do this with the client laying on their back. So you always want to use some lotion. Lotion is going to really help because it's a very sensitive area. What you would want to do is get your table up as high as possible as you can, because that's going to help you with your body mechanics. Now the key is actually the positioning. So what you're going to do is have the client scoot their body over a little bit, and that's going to get everything to open up. Get a little bit of lotion in there to open that up. Make sure you watch the advanced palpation of the subscap. If you don't watch that and get this right, and you try the treatment before, it's going to be very counterproductive. Now the key is going to be in the motion. So once we get in there and we find the area that needs the treatment, what we do is we start it in a very shortened position, and then the first thing we're going to do is get this arm to open up and come back. That's our first motion. That's the motions we always want to get on the shoulder, is bringing this arm back, because if we don't get that, it doesn't matter what the other motions are. So the key here is your body position. So we want to approach it like a 45-degree angle, very similar to what we talked about with the 𝐵 spinatus. So the motion here is I'm going to be lined up just like that. And as we go in, that allows me to sink in on that subscap. Then I back out. I've already done the palpation. I've already found all that. And then I'm going to put that muscle in that shortened position. And my depth is going to be just a very slight drop in with my body weight, maybe about 4 or 5 ounces of pressure. And then my tension is going to be a lean straight across. And that's loaded up. And we're going to put in a little more shortened position. And what you're going to do is slowly start to drop that in just like that. And you're going to go very slow, very precise. When you feel it start to pull, now you're going to shift your body around and you want a traction with that. And you're not in a rush. You're getting that to open up. You're leaning in with more of that tension.
Body mechanics.
You want to continue to go slow. We talk about this. To go fast, you have to go slow first, and you don't need to be in a rush in here. Now, the mechanics are very important. The first thing is you're going to line up, and you're going to sink in just like that. Going to back out, and your depth is going to be just a very slight elbow drop to the floor. That's all you need. And then your tension is going to be a little bit of a lean. That's loaded up. You're going to start to move the arm. About 25%. You're going to feel that, and then when it starts to pull, you're going to shift your body and go just like that. It should not be painful. It should not be excruciating. If it is, you did not watch the advanced palpation video. This is very important for an effective shoulder treatment and resolution of the shoulder problem, but you gotta get your body mechanics right. So you're gonna practice kind of going in here with that, stepping and going just like that. And that's where it comes from, the setup and getting the setup correct. Because if your setup isn't correct, you're not gonna get an effective treatment.
Take homes from that video, once again, slow the hell down, take your time, find it, slow down, less depth, more tension. It should not be excruciating, it should not hurt like hell. If it's excruciating or hurting like hell, you're probably too compressive, you're probably actually not even on the subscap, or you're on top of one of those nerves in there and really starting to piss it off. So making sure you go slow in order to go fast is very key and will help you in success long-term in getting long-lasting results and pain relief. A couple lessons from the series. I want to continue to teach you to be a clinician first and a technician second. Don't be in a hurry to jump into treatment. Think critically, collect data, answer questions, why this is happening, and be able to actually answer that question of why it's happening before just jumping in blindly and treating a bunch of stuff and never really know what's going to happen. Once again, slow down. You have to go slow in order to go fast. Do less treatment, but do it actually a lot better than anyone else out there. And quality. It's all about quality. It isn't quantity. If you can fix a problem in 10 or 15 minutes, it usually takes someone 20 or 30 minutes, you're actually way more valuable. But you got to collect data, you got to slow down, you got to think critically and be that clinician first and that technician second. So if you like this video series, give it a like, a comment, a share. Go grab our free training. We really dive into critical thinking, palpation, really getting on the idea of being that clinician first, technician second. And we do offer CEU courses that are available online and in person. All the information for that is available in the descriptions or wherever you're consuming this content. I appreciate you guys watching the video, and we'll see you on the next one. Bye.